Imagine your brain, a truly incredible organ, as a grand orchestra with many sections, each playing a unique and vital role. When one section suddenly stops playing or plays out of tune, the harmony of the whole performance is affected. This is a bit like what happens during a stroke, and it raises a critical question about recovery. The answer is a resounding yes. Different brain parts absolutely need different stroke care. Stroke treatment and rehabilitation are highly personalized, precisely because the brain is a complex network where each area has specialized functions. The specific location and extent of the damage are paramount in determining the best course of action. Now, why is this the case? Your brain isn't just a single, uniform entity. It is composed of distinct regions, each responsible for controlling different aspects of your body and mind. For instance, if a stroke occurs in the motor cortex, it might impact your ability to move your arm or leg. A stroke affecting Broca's area could hinder your speech production, while damage to the occipital lobe might affect your vision. Furthermore, the type of stroke matters too. An ischemic stroke, caused by a clot, requires different immediate interventions than a hemorrhagic stroke, which is caused by bleeding. Doctors relying heavily on advanced imaging techniques, such as computerized tomography scans and magnetic resonance imaging, to pinpoint the exact location and nature of the stroke damage. This detailed mapping is crucial because it allows the medical team to understand precisely what functions might be compromised. This detailed understanding translates directly into your care. For instance, if a stroke impacts the language centers, speech and language therapy will be a cornerstone of rehabilitation. If motor skills are affected, physical and occupational therapy will focus on regaining movement and coordination. Even immediate treatments are location-dependent. For an ischemic stroke, clot-busting medications might be administered, but only if specific brain regions are not already too damaged or at risk for bleeding. For some hemorrhagic strokes, surgery might be necessary to relieving pressure on the brain. The care plan is a living document, constantly adjusted as your recovery progresses and your unique needs become clearer. What is particularly fascinating is the brain's remarkable capacity for neuroplasticity. This means the brain can actually rewire itself, forming new neural connections or strengthening existing ones, especially in response to targeted intensive therapy. For example, a specialized approach called constraint-induced movement therapy encourages the use of a weaker limb by restricting the stronger one, helping the brain to reorganize and improve function in the affected area. This ability to adapt and reroute neural pathways is a powerful ally in stroke recovery, making precise, location-specific rehabilitation even more effective. Ultimately, recognizing that different brain parts necessitate different stroke care empowers medical professionals to create highly individualized treatment and rehabilitation plans. This tailored, multidisciplinary approach, guided by detailed diagnostic imaging and a deep understanding of brain function, is the key to maximizing recovery potential and helping you or your loved one achieve the best possible outcomes and an improved quality of life after a stroke.